Hi, I'm Bob Herbert. Welcome to OpEd.tv. Ebola is indeed a scary disease. In Africa, the death rate for those who have contracted the virus has been frighteningly high. But have we gone overboard in our fear and loathing here in the United States? The disease is not easily transmittable under most circumstances, and there have been only a tiny number of confirmed cases in the U.S. And yet we've seen some schools and business operations temporarily closed. Passers-by in situations having nothing to do with Ebola have panicked at the sight of someone with an upset stomach. A public school teacher from Maine was placed on a mandatory 21-day leave simply because she had traveled to the city of Dallas. Some of our public officials and media commentators have been less than helpful. Their remarks in many cases have contributed to a range of irrational fears. We'll try to sort fact from fantasy and put matters in perspective with my guest, a physician, a longtime leader in the field of international public health, and the dean of CUNY School of Public Health, Dr. Ayman El-Mohandes. Doctor, thank you so much for being with us today. I really appreciate it. Before coming to CUNY, you were the dean of the College of Public Health at the University of Nebraska, and the medical center out there has been dealing with the Ebola crisis. So let's start with how large a public health issue we're facing here in the United States versus what we're seeing and what has been going on for some time in West Africa.
Well, there's no question that we're faced with a global, new, kind of scary public health challenge, an infectious disease that seems to have a high mortality rate where it is most prevalent currently in West Africa, with the potential of moving to our country through travelers. We've already seen some cases. So, this is psychologically difficult to deal with, especially when people are hearing some information that is somewhat scary of how quickly it can spread and who might die. And recently we had a patient die in the United States, and that itself is enough to make people wonder about how safe they may be and their families as well. So it's understandable that there's a certain amount of fear. We hope that this doesn't turn into panic or hysteria. And in my opinion, in my experience, I'm always convinced that panic is not a product of knowledge but ignorance. And if we spread correct information, share correct information, the likelihood of panic and hysteria is less, not more.
So if we do try to spread the proper information and keep things in perspective, for ordinary individuals who are not in contact with anyone with Ebola or caring for anyone with Ebola, is there any real reason to be concerned about your safety?
I think not. I think at this point we are taking the appropriate precautions as a city. All that we are hearing about precautions taken at the airport, for example, are reassuring that people coming from areas where the disease is prevalent will be monitored at the time of arrival. We hope mostly also to spread a sense of civic duty that if there are people that were somehow thinking that they were exposed, that they would present themselves. I know that in New York City we had about 80 people say they thought they were at risk. Of those, only 11 people I think panned out to be truly at risk, and none of them really had Ebola. Many had malaria, which is a much more prevalent disease than Ebola, and one of them I think had typhoid. So the reassurance at the community level is that people feel confident that people will behave responsibly, and that if they are within these set of circumstances, that they will present themselves, and that the healthcare delivery system will be responsive and will take responsibility for reassuring all of us that these cases are treated appropriately, that they are monitored appropriately. We just had a case from the airport going to the medical center in Newark, and at the end of the day, it took just a day to reassure all of us that this was not going to be the first case in the New York area.
Right. Now, these 11 folks who had reason to think there was a possibility that they'd been exposed. It turns out that they had not been exposed. But why did they have reason to think they might have been exposed?
Well, I don't know every single one of them, so I couldn't tell you in detail, but I know that we know that if you were in West Africa or had somebody with you from West Africa who was symptomatic in some way with a fever, vomiting, etc., that you might consider yourself to have been at risk. Now, what we are seeing is that there needs to be close contact where body fluid contaminates your body surfaces, and then you touch yourself, maybe rub your eye or your nose. That is the way infection occurs. So just being in the same environment doesn't seem to be associated with very high risk. So if you believe that you are under conditions such as this, you are expected to monitor your body temperature every day for a period of 21 days, which is the incubation period of the disease. And if you emerge from these 21 days without any symptoms, then you are scot-free.
You're home free.
Exactly.
Right. Okay.
But if you have some fever, for example, then you should present yourself to the healthcare delivery system, and they will take it from there. The Department of Health and Mental Health in New York City is very adept at managing and investigating other potential contacts, and the lab tests now can tell you quite easily whether or not what you have is this virus or something else. So these people developed a fever. They deemed themselves to have been under circumstances where they could have been exposed to somebody sick with that disease. They were tested and found indeed to be sick, but with other diseases that are more common.
Right. If it's not spread, as far as we know, by casual contact, why is there such concern about traveling on public transportation, airplanes, but presumably it would be the same with buses or trains or whatever?
I think at this moment everybody is taking the side of caution. The plausibility of being in public transportation and having somebody with Ebola throw up, for example, is remote, but is still a risk that people are trying to avoid. So the advice is not to use public transportation if you are symptomatic and if you think you are exposed in some way, so that others may not be exposed. I think the message has been delivered. Most people have heard this. There are only a few of us that are truly at risk, and we hope that they will behave responsibly. If there is too much panic, if there is too much stigma, this is what drives people that could be at risk to do the wrong thing.
If the stigma gets to be too great,
exactly,
someone who really does have reason to be concerned and who needs to get treatment may not seek that proper treatment and may not take precautions to prevent the infection of others.
Or may not seek help.
Right. Well, if there's no cure for Ebola, and someone said to me, well, if there's no cure, how is it that everyone doesn't die from Ebola? I'm not a doctor, and therefore I didn't have an answer for this person. So explain that. What happens to?
Yeah, very few viruses have a real treatment. The common cold is obviously the example. It may be a very bad example because the common cold obviously is not as serious as Ebola.
But there's no cure for it.
Absolutely not. We deal with the symptoms, and we hope that the body can mount a response, an immune response that overcomes the virus. That's how most viruses are dealt with in our body. Measles, mumps, the common cold, influenza. Most of these viruses don't have a treatment. It's only because of the seriousness and the spread of HIV that a great deal of time and effort was spent in trying to find certain treatments that play a role so long as you're taking them. And if you stop, it seems like the virus reemerges. So they suppress the virus rather than eliminate it completely. So that's the story of viruses. But nonetheless, we've survived them.
Right. Clearly, there's a very serious, very tragic situation in West Africa, especially in Guinea, Sierra Leone, and in Liberia. But I think a lot of Americans were not aware of this. Public health experts have been aware of Ebola outbreaks in Africa over the past few decades, and those outbreaks had been contained, so they didn't become an epidemic. Now it appears the situation is somewhat different, more serious. Why is that? What changed?
Well, it's not exactly easy to say what changed. I think the thing that is very striking this time is that we are looking at an epidemic within an urban environment. And, you know, Africa, the rural environment is very different. The previous outbreaks in East Africa, or the smaller outbreak in East Africa, was in a rural environment where it was contained simply geographically and environmentally. When you are beginning to talk about people getting sick in overcrowded cities, the likelihood of exposure is greater, and the likelihood of spread simply by the population density is greater. And I think that is what we are experiencing and learning from in this particular outbreak in West Africa.
Now, in Nigeria, they had a problem with Ebola, but it seems to have been contained. Mm-hmm. What is it that Nigeria did well or better than these other countries where it's still threatening to get out of control, actually?
I think they created restrictions on travel and mobility across their borders. And I think the threat in Nigeria is of a very different nature than that in the United States. I mean, the number of people that could easily cross the border in Nigeria would far exceed what we have here. So
Right.
they were vigilant about restricting mobility across their border and you know, managed the few cases that were declared, and they seem to have been successful in controlling the spread. In our case, nobody's crossing the border really as we know it currently, or that we think, although, you know, some panic messages where they could
Right.
go to Central America and cross the border and so on. You need to understand that these people are very, very sick. They're not going to walk in deserts and cross borders from country to the other.
And you need to be
easily.
symptomatic to transmit the disease, right?
Indeed.
Yeah, okay.
Indeed.
So, and also, there are not direct flights from any of the three nations, Guinea, Sierra Leone, or Liberia, to the United States. So for someone to come in from one of those countries, they'd have to take a flight somewhere else and then come into the United States. So just simply shutting down those flights does not take care of the problem.
I think most of these flights are coming from Europe. So
Mm-hmm.
most of the travelers from these countries come through Europe,
Right.
Brussels or Paris maybe. And that creates an additional barrier where if people were symptomatic, they're more likely to have been identified or diagnosed on their
Right.
way down here. But at the same time, you know, people travel and people can be exposed in different ways. And I think the right message is be responsible. If you think you're at risk, and at risk means you're either in one of these countries within the past 21 days or came in contact with somebody from these countries within the past 21 days and they were sick.
Right.
And you were with them, and you're not sure whether your exposure was minor, minimal, or whatever, the advice is, why don't you measure your temperature every day and isolate yourself for the period of the incubation? And if you are ever symptomatic, please present yourself immediately to the healthcare delivery system. I think the message is fairly clear. And for every one passenger coming to New York through Brussels, there may be another person under a different circumstance that we don't know of.
Right.
That was in Spain or was in another country where there are cases that could have been exposed in some way or the other. And I think this is a situation where we expect people to behave responsibly and to be supportive of themselves, their families, their communities, in a way that doesn't spread panic unnecessarily and in a way that's not going to help them or anyone around them.
One of the things the United States is doing now is with travelers who are coming from these affected nations, even though they're coming through Europe or from other places. They're required to disembark at, I think it's 5 different airports in this country where they are then tested to see whether, essentially whether they have the disease or symptoms of the disease or something of that nature. So that's already in effect. President Obama has appointed a so-called Ebola czar, and protocols and heightened levels of training are also being put in place now. Are you satisfied with what public health experts and the government specifically itself are doing now? Are we doing enough?
It's hard to respond to that question objectively. I think we're doing what we can do at this present moment. Training people, spreading the right information, preparing hospitals better to deal with cases if they present themselves. People might present themselves in an emergency room, so making sure that emergency rooms play safe and don't expose their personnel in a case that's questionable, for example. These are things that are helping us contain the potential for spread. From a logistical point of view, it's important to have somebody coordinate. There's a lot of debate whether this person needed to be a physician or not a physician. I think you need both. You need information from the physician side, the public health side, the scientific side, but you also need somebody from the logistics side, whether you call him a czar or you call him a prince or a king or a tribal chief, is really of very little consequence.
The title is not
But the government does need somebody
Yeah.
that can help them coordinate in case of an outbreak. They need somebody that can deal with the logistics, with the transportation system, with the border security, with the police, with all sorts of people that could be engaged or impacted upon or involved in a situation of risk.
As a physician who has dealt with public health crises internationally in many countries over many years now, what worries you the most? What are you most concerned about given the state of affairs in the United States right now?
Well, I mean, in the U.S., obviously, there haven't, in the last couple of days, we've not seen any new cases impacted by the spread. I think the more time that goes on without seeing new cases, people will be less anxious, and I think we need to be less anxious. Dealing with crisis is best dealt with when people are not acting out of anxiety or panic. But at the same time, we have to be realistic that as long as there are cases and more cases in West Africa, that the threat remains. And Dr. Frieden just said that, the director of CDC, I think yesterday or the day before, that we cannot consider ourselves to be completely out of the zone of risk until the epidemic itself in the countries where it is occurring most actively is brought under control. So it is incumbent upon us to think of ways in which we can be helpful. These countries are of limited resources, and being exposed to such a major challenge, economic, health, and practical challenge, requires us to assist remotely with expertise, with resources as necessary, and understand that this is not just out of compassion, but also out of self-interest, that once we help these countries control that epidemic, our risk then drops significantly.
Well, you anticipated my next question, which was, if we really wanted to make a big difference in West Africa and bring it under control, one, because there are human beings who are at terrible risk there right now, who are dying, and whose families are being destroyed and that sort of thing. So just from a humanitarian reason, you should want to help.
Absolutely.
But also, as you pointed out, it's a self-protective mechanism that, that's where the disease can travel from. So if it was an all-hands-on-deck approach, what would be the kind of things you'd like to see done from an international perspective? One
of the things that we are seeing also in these countries has been almost an implosion of their healthcare delivery system. Regular patients are being very fearful of going to hospitals caring for Ebola patients, thinking that the risk for them themselves to be exposed is high, and therefore people who need care are not receiving it. And
so people who don't have Ebola, but who are ill, don't want to go to the hospital.
Exactly. And as a consequence, some of them are actually dying. And so there is now an attempt to create almost a parallel healthcare system where patients who are non-Ebola can receive care in non-Ebola facilities, and those that are actually sick with Ebola can receive care elsewhere. Now, mind you, this is not very easy to create a parallel healthcare system overnight.
I would think.
And, you know, sorting out who has what and how that is managed in itself is a logistical challenge. And so we are trying to help with some of these things. I mean, the United States is bringing in expertise, talking to governments, coming up with ideas, but I'm sure that from a logistics point of view, they will need all the help they can get, and from the resources point of view, they will also need assistance.
Now, the doctors and nurses and other medical personnel who care for Ebola patients here in the United States, in Africa, wherever in Europe, wherever it might occur, they seem really like heroes to me. This would seem to me to be a frightening way to make a living or to pursue your profession or whatever. As someone who's within the profession, how does it seem to you? Do they seem really heroic, or is this what you expect from healthcare personnel?
Well, you know, clinicians, nurses and doctors and healthcare providers have sworn an oath to be at the side of those that are in greatest need. You know, we should glorify them as much as we glorify the firefighters that throw themselves into the flames to save a human life. We chose to be in healthcare because we understood the risks, but also understood the rewards. I think in my mind of the 14th century plague outbreak in Europe and the nuns sitting next to the plague patients where there was no treatment.
Isn't that something?
And sat by them until they either survived or died. Many of the healthcare providers over the years, I think we forget this aspect of who healthcare providers are. They are frequently heroes too, and they are driven by a mission. This is a very scary situation. We don't have very many deadly diseases that are transmissible like that. And so we as healthcare professionals need to overcome our own fears, but also certainly the facilities that protect us today are much, much more efficient than what existed even 10 years ago, let alone centuries ago. But this is an aspect of what healthcare is about, is standing by the patient and sometimes forgetting your own self-interest.
Wow. We've run out of time. I want to thank you so much, Dr. Ayman El-Mohandes, for talking with me about this.
It's a great pleasure.
We'll be back in a moment with a final word. Here we are more than 13 years after the terror attacks of September 11, 2001, and we are still very much at war. Not only are American troops still in Afghanistan, but we are now bombing and flailing about for other ways to defeat the Islamic State in Iraq and Syria. As usual, for the privileged among us, these are wars to be fought by other people's children. America's fighting men and women are drawn from a tiny, tiny portion of our population, much less than 1%. For the vast majority of Americans, war is no burden at all. We are called upon to make no sacrifice. We're not even asked to pony up additional taxes to pay the costs of our wars or to cover the treatment of those troops who come back horribly wounded. We just put that on a credit card. This is wrong, in no way for a great nation to behave. If America is at war, we all should be at war. We should all be called upon to make some sacrifice. Going to war is really easy, too easy, when it's somebody else who's in harm's way. That's all for now. See you next time.